All right, Tracy, thanks so much for doing this. My first question that I have for you is tell the audience a little bit about yourself and how you started in the mental health community.
Yeah, so my name is Tracy Vadakumchery. I am a licensed therapist. I am licensed in New York, New Jersey, Florida, and California. And I got into the mental health community when I was like interning for some nonprofits and student affairs in undergrad. And I just realized I had a passion for people. And it kind of evolved from there. I really wanted to work with like college students that never really panned out, but um yeah, that's how I got my start. And I call myself the bad Indian therapist. And now I work with South Asian Americans who are struggling with toxic guilt, toxic shame, perfectionism, and people pleasing.
Let's dive into those a little bit more. So like what, because I was going to ask like what do you do in your current role as a mental health professional?
Yeah, so currently I run my own private practice. I've been in private practice since 2021, so a little less than 4 years now. And I currently, I'm doing a lot of content creation on Instagram and TikTok. You probably find me there. I've got some strong opinions on things that maybe some people agree or don't agree with. I also do individual therapy sessions. I've launched a course on toxic guilt for Indian and South Asian Americans who really struggle with guilt and shame. I've also launched a couple of groups for therapists, an online community for South Asian Americans who struggle to feel like they belong or fit in. So I'm multifaceted.
Mm-hmm. Yeah. So let's talk a little bit about the work that you do in your private practice. So like when you go see like clients, what does that session sort of look like?
Yeah, every therapist is different. So every therapist might run their sessions a little bit differently. For me, I kind of like to spend the first the first session really is just like the intake or initial session. We just kind of talk about whatever's on your mind, and there's really no direction for the first session or so. I'm just kind of gathering more information about you as you speak, as you talk, just learning a little bit more about your history. And then after a while, after we kind of warm up to each other, every following session, I spend the first 10 minutes kind of like catching up, kind of asking how your week went, maybe following up on some things we talked about last session. And then I like to introduce a theme. And a theme is something that like I notice in my client. Like I notice that you do this thing. I wonder what's that about. I like to kind of focus on a specific theme. I like to give my insights and my education on it and then just like kind of ask for your thoughts and see if like anything like that has ever happened in your past and help you kind of draw connections. And then at some point when we're like, okay, like I understand myself now. Now what? We kind of get into more deeper tools and techniques.
Hmm. My next question is, what sorts of methods do you use that you've learned that you use in your current practice? Because I'm sure you've heard of the Gottman method, and there are other methods out there, but specifically for your practice, what methods do you use?
That's a very good question. There's a lot of different modalities out there. So, modalities are like general approaches, and then techniques are like the specific tools within each approach. And that looks different for every modality. So, like the Gottman method, that is one modality. It's usually for couples counseling. So, the techniques within Gottman might be more focused on like communication and listening to each other. I'm not trained in Gottman, so I don't really know. But Gottman would be a modality. And then the tools and techniques about communication and empathy and listening within Gottman, those are their specific tools, their techniques. I was trained initially in cognitive behavioral therapy, that's CBT. That's basically about identifying your thoughts, identifying your emotions, identifying your um, triggering events. That is very much like CBT work, a lot of writing, and there's also a lot of like challenging of what we call thought distortions. Sometimes that looks like all or nothing thinking. Sometimes a thought distortion could be overgeneralization, and CBT can be helpful, but there is a lot of critique of CBT that it's not really emotionally deep or it's not very validating of marginalized experiences. So I also specialize in trauma informed approaches such as eye movement desensitization and reprocessing, also known as EMDR. And that engages both the left and the right sides of the brain, either with eye movements or shoulder tapping, knee tapping, the butterfly hug, different ways of engaging the left and right sides of the brain to process trauma. I also do a little bit of ACT, acceptance commitment therapy, ACT, and that focuses on it pulls a little bit from CBT, but it's more flexible. It's more about mindfulness. It's more about making choices, making decisions that feel good for you, that are in support of your values alignment. So I do specialize in a couple of different approaches, but personally, I'm a little bit more of a fan of ACT, and a little bit more of a fan of EMDR as well.
Mm-hmm. So let's go back to the content creation piece of this, because you said that you were on social media producing content. What's that content about, and like what made you sort of come up with that?
Yeah, so on social media, I call myself the bad Indian therapist. And I really came up with that title because growing up, I think that there was this idea that there's only one right way to be brown enough or to be Indian enough. Um, and I was just kind of really fed up with it about this idea of like being brown enough or being a good Indian or a bad Indian. So I called myself a bad Indian therapist because I don't really fit a box. I don't really fit people's expectations of what they think I should be, both within and outside of the Indian diaspora. And I feel like a lot of what I like to call South Asian misfits, even those who aren't Indian, like people who are Pakistani and Sri Lankan, can really identify with this idea of like not feeling brown enough. And maybe that's okay. Maybe you don't have to prove that you're brown enough. Maybe you don't have to prove that you're cultured enough. I think that over the years, my content creation has really evolved from that to also talking more politically about how the model minority myth really influences our idea of what it means to be a good Indian or what it means to be a perfect Indian girl. So a lot of my content creation has also shifted to talking about, well, I'm not going to fit America's idea of what a good Indian should be either, and I'm not going to feel bad about that. I'm not going to feel ashamed about that. I'm also a human being. I'm not supposed to fit a box. So a lot of my content creation is really centered around validating those experiences for so many South Asian Americans who don't feel seen or heard in the mainstream social media space, who feel like they have to be cultured enough to truly belong.
Mm-hmm. And when it comes to posting content on social media, there are often people that are supportive of one's content, but also people that are, that are trolls and that are haters. So like how do you sort of deal with those kinds of people? Because there can be some of those people, you know?
I definitely know. I get my fair share of trolls. I get my fair share of people who are definitely very negative from all types of backgrounds, right? Like even like people who are Indian will say really terrible things on my Instagram, on my TikTok. I get people from all over who are upset that I'm not catering to their fantasy in their head of what they think I should be. They have this idea that to be an Indian American or to be an Indian woman, you have to be one way. And if you don't fit yourself inside that box, I now have the right to disrespect you. You have to be perfect or else. So I do get a lot of comments like that. And to be honest, it's really jarring. I don't think there's ever really truly getting over that, especially not in this day and age. I know that I'm also in my own therapy as a therapist. I'm also in my own therapy. I go to my own trauma therapy to kind of help me stay in check and make sure that I don't become a jaded person from all of this and that I don't project any of that pain onto other people either. I think my therapy sessions in my own life kind of help me like sit with how difficult that is and really acknowledge like yeah that's fucked up and I don't want to be that kind of person to other people either. So therapy just also allows me as a therapist to also be human. And I also do kind of organize in my brain like what spaces online are safer for me and what aren't. And the ones that aren't, I still show up because I want people to feel seen. But I'm also very limited with how much I spend time on there. So I have found that Instagram tends to be a little bit safer for me. I kind of take my time with like TikTok and threads because I found like I get the world's worst people on there. And another thing that has really helped me is also making sure that I have a strong support system in real life, offline, right? Like I would not have been able to survive content creation if I didn't have my people, my community, my friend group. I think it's super important that therapists, regardless of whether or not you are on social media or you're not on social media, that you have a life outside of your job and that you have a support system outside of your job. You need to know who you are outside of those spaces, and you need people who love you who remind you of that.
Mm-hmm. It's really interesting that you point up you where so oftentimes people that have multiple identities don't often fit in, and that social media can often be sort of hostile or hateful towards that. So my question for you is, have other patients that you've worked with had that similar experience like you did? What were the stories in that regard?
I think that for my clients who often have to struggle with multiple marginalized identities, and struggle with fitting in is that it really impacts their family relationships the most. And that is like supposed to be your number one support system, right? Like that really is supposed to be your your in real life community support. But let's say for like South Asian people who are queer or in queer relationships, they may not be able to come out to their family without that loss of support. So they can't truly be who they are around the people who love them the most. Otherwise, that means potentially losing your only support system here in America, right? Like to be the child of immigrants and to be queer means that you don't really have a strong security or safety net here in America either. So, can you really afford to lose your family support? Um, and then, coupled with that, there's also the stigma within the broader South Asian diaspora, the homophobia, the queer phobia within the broader South Asian diaspora. Sometimes your own cultural community is not your safe space. So, often for a lot of multiple marginalized identities, you kind of have to negotiate what support looks like for you. And sometimes your own community is not your support system. It comes to loss. There's a lot of losses that um, many queer South Asians in particular are not ready to confront, and that's okay. Like coming out is a process, and you don't have to come out either in order to be valid. And that's the other part of being a good Indian or a good South Asian. Like you don't have to be a good queer person either. Um, so there's a lot of internal conflict, a lot of external compromising that comes with being a person of multiple marginalized identities who doesn't fit in.
Hmm. It's this idea that not all ethnic groups are monolithic, right?
Yeah.
Hmm.
Yeah.
So, my next question is, when people in those with Asian identity go through those struggles, how do you make sure that, particularly in those sessions, that they feel seen or heard?
Yeah, I don't want to be another person in their community. Like, let me give you an example. You know, one of the best I don't work with people who struggle with addiction, but one of the best advice that I had gotten for people who struggle with addiction is that you as a therapist, you don't want to be another adult telling them what to do, right? You don't want to be another person telling them no, shame, bad, don't do that, because that's not helpful either. They hear that from like everyone around them, right?
Mm-hmm.
So for me as a therapist, when it comes to people who are South Asian, who are of marginalized identities, who don't fit in, I don't want to be yet another person, yet another adult in their life saying, no, bad, don't do that, especially for like South Asian women, especially for like queer South Asians. They probably had everyone around them tell them that they should be ashamed for honoring their desires. And I don't want to be yet another person who validates that. I'm not here to validate the community. I'm here to validate the person in front of me. So even if we can't change our outer world, can I give my clients hope that there's at least one person who is on their team? And if at least one person is on their team, is it possible that yet another person out there can be on their team, right? Like I'm just their therapist, but if I'm on their team, maybe there's got to be somebody else just like them out there too.
Mm-hmm. My next question is, what have you learned in doing this type of work as a mental health therapist?
I have learned that really, I think people just want to feel connected and they want to feel like they'll be accepted for all of who they are. And I find that when so many people talk about community, they're often talking about people who look just like them, but they're not talking about people that they may have something in common with, but also have a lot of differences with, right? Being in community with people also means acknowledging that there will be people who are different from you, right? Like there will be queer South Asians, there will be like South Asian women of marginalized identities. Like we don't all have to be the same to be in community with each other. Um, and my whole thing is like, if we don't care about are most marginalized, then are we really doing that community that we keep speaking about? Like, are we really about community?
Mm-hmm. And what do you still want to learn as a mental health therapist?
That's a really good question. I think that I'm trying to expand a little bit more in terms of my offerings. I'm constantly trying to find that balance between like, what can I do versus um how like what my limitations are, because at the end of the day I'm also human. I can't help everyone, I can't do everything. um and I think like what I'm trying to learn more as a therapist is how to really reach multiple people at once. I'm currently doing more individual work. I'm hoping to kind of expand into group therapy and family therapy work eventually in the future. So stay tuned. I used to do family therapy a long time ago. I don't do it anymore, but I'm hoping to expand that eventually and also do group therapy as well.
Mm-hmm. And finally, for the people that are wanting to enter the mental health profession, what tips or advice would you give those folks, who are thinking about entering the mental health therapy, and that are kind of just curious, what should I do? How can I get involved?
I think like the most important thing to remember is you're going into this field. There's a lot, but I just want to remind that you are human, right? And like you are more than capable of doing everything that you want to do in this field, but also just remember who you are outside of your job, because that's actually what's going to help you be a better therapist, right? If you're a therapist 24/7, you don't truly know how to relate to people outside of your job. And if you don't know how to relate to people outside of your job, you can't really give concrete suggestions or advice to your clients who are struggling with real life relationships. So it's important to know who you are outside of your job. Make sure you have a strong support system. I would also say that there's probably going to be a lot of therapists in the field who are going to tell you about all of the things that you can't do. And of course, there are some things that you can't do because it's unethical, but sometimes therapists project. And I like to say that if people knew how often therapists project, people wouldn't go to therapy, right? But therapists, like I said, are also human, and they can also have their own insecurities, especially towards each other as colleagues, as professionals. So there's going to be a lot of therapists who are going to wag their fingers and say, you can't do that. But that doesn't mean that they're right. So if you have a mission, if you have a goal, it is totally possible.
Mm-hmm. All right.